Hello there, can you smile and let me see your teeth? I'm a tooth, you can call me Toothy. Today, I'm about to show you the importance of having good oral care, so stay tuned. So, why oral care is important in our life? Well, it is one of the key indicators of health, well-being and quality of life as mentioned in World Health Organization or WHO. Around 3.5 billion people affected with dental disease and conditions such as gum disease, tooth loss, oral-dental trauma, and even mouth cancer. These are the common oral problems among children. The first one is gingivitis. It is a gum disease that caused by interaction of bacteria in the mouth with leftover carbohydrate to form plaque. Meanwhile, dental caries is a condition caused by acid produced by bacteria in our mouth. This acid eventually will break down the enamel of the tooth to form cavities. So, how to prevent this from happening? Well, the answer is a good oral hygiene. Do not fear. What you need to do is just follow these 6 steps for better oral hygiene. The first step is by choosing toothbrush. The main criteria for the right toothbrush are size and bristle. For size, you may consider a toothbrush that allows easy access to all surfaces of your teeth, including certain hard-to-reach areas. The handle of the toothbrush should be of the suitable length so it will be comfortable to use. For bristle, a soft bristle toothbrush will be the most comfortable and safest choice. Therefore, it is recommended to use rounded tip bristles for better tooth protection. Now, moving on to the second step, which is choosing toothpaste. A few criteria need to be considered in choosing toothpaste. The first one, it must contain fluoride. Second, it must contain active ingredients to improve oral hygiene. Toothpaste should be free from flavoring agents such as sugar. And lastly, it must have scientific evidence to support that it is safe and effective. So, which toothpaste should you pick? Let's go discover one by one. Fluoride toothpaste is the most common use, which helps to protect teeth from the acid release, makes your tooth enamel stronger, and remineralizing areas that have started to decay. Tartar control toothpaste helps to prevent the build-up of tartar on teeth. Some of them contain antibiotic which kills bacteria in mouth. Next is toothpaste for sensitive teeth, which contain potassium nitrate or strontium chloride, which help in reduce tooth sensitivity by blocking nerve pathways. And lastly, whitening toothpaste, which contain abrasive particles or chemicals such as hydrated silica and titanium dioxide that helps to polish the teeth effectively. Now, we go to the third step, which is proper brushing technique. Let us watch this video clip. It is important to clean your teeth properly twice a day every day. Otherwise, plaque and tartar may build up on your teeth. If you are not reaching all the surfaces, a proper brushing technique and some simple tips will help keep your smile clean and bright. Use a soft bristle toothbrush with small head for better reach and brush gently. Step 1. Start with the outer surfaces of your teeth. Next, brush your upper teeth and then your lower teeth. Tilt your brush to a 45-degree angle against the gum line and sweep or roll the brush away from the gum line. Next, brush the inner parts of your teeth using a back and forth motion. Then, brush the chewing surfaces of your teeth with short back and forth strokes. Make sure to brush your tongue to remove any odor-causing bacteria. And remember to brush for at least 2 minutes, twice a day, for a fresh, clean, happy smile.
Hi, I'm Fruity. Let's tag along with me until the end of this video. Besides having the right toothbrush, toothpaste, and the correct brushing technique, it is also necessary to replace our toothbrush to ensure good oral hygiene. It is recommended to replace the toothbrush every 3 to 4 months or when the bristles are broken, frayed, or bad. This is important to ensure optimal plaque removal ability of the toothbrush. Interdental cleaning aids and mouthwashes are important for oral hygiene. Types of interdental cleaning aids are interdental brush, floss with handle, and floss. Now, let's move on to floss technique. First, Break off about 18 inches of floss and wind most of it around one of your middle fingers. Then, wind the remaining floss around the same finger of the opposite hand. This finger will take up the floss as it becomes dirty. After that, hold the floss tightly between your thumbs and forefingers. Guide the floss between your teeth using a gentle rubbing motion. Never snap the floss into the gums. When the floss reaches the gum line, curve it into a C shape against one tooth. Gently slide it into the space between the gum and the tooth. Hold the floss tightly against the tooth. Gently rub the side of the tooth, moving the floss away from the gum with up and down motions. As previously mentioned, mouthwashes are important for oral hygiene too. There are two types of mouthwashes. Cosmetic mouthwashes are for temporary control of bad breath and may leave behind a pleasant taste. For therapeutic mouthwashes, it contains active ingredients intended to help control or reduce conditions like bad breath, gingivitis, plaque, and tooth decay. It is advised to use mouthwash after brushing and flossing. After brushing and flossing your teeth, pour the mouthwash into a cup provided with the product. Then empty the cup into your mouth and swish the mouthwash inside your mouth for around 30 seconds to 1 minute. Then when you're done, spit out the mouthwash. Other than cosmetic mouthwashes, mouth spray also can be used to cover bad breath. It has the ability to maintain oral freshness for about 4 to 6 hours. The common ingredient of mouth sprays are mints and chemicals with antibacterial and anti-plaque properties. Spearmints and peppermints are used to maintain freshness inside the mouth. Chlorine dioxide and chlorhexidine are used to provide the antibacterial and anti-plaque properties of the mouthwash. Let's learn on how to use mouth spray. Simply spray to your tongue or the inside of your cheek. Make sure to not inhale the spray or spray to the back of your throat, and do not drink immediately after the use of spray. How often should we have dental visit? It is recommended to visit the dentist once a year or every 6 months. Remember, better teeth, better health. Tutti and Fruity signing out. Thank you for watching this video.